At Baptist MD Anderson Cancer Center in Jacksonville with Leanne Mingle. Thank you so much for having me.
Yeah, thank you.
Yeah, tell us a little bit about your role here.
So I am Vice President of Operations, and I get to be a part of everything that happens in the Cancer Centers.
And that includes research
It does
in your
include
program,
research.
which is so important. So talk about that a little bit.
It is important. It's one of the first things people want to know when they're coming to Baptist MD Anderson or any cancer center is, are you using the latest and greatest? And so by having a research program, we are ensured that we are connected to all the neat scientific things going on in the medical community throughout the United States.
Yes, innovation and evolving as the time goes on.
That's exactly
and
right.
using those practices and the multidisciplinary teamwork.
That's
Tell us
right.
a little bit
That's
about what
right.
that means and why that's important.
So that's probably our biggest goal in providing care. So for instance, when every new patient comes to the cancer center and they have a diagnosis of cancer, they are put in front of a multidisciplinary team. And that might be a radiation doctor, it might be a medical oncology doctor, and a surgical doctor, and they are all talking about your case. And they are trying to figure out what is the right treatment modality. Which one's first? Do you need all? You know, what does it look like? And so decisions are made on that patient, on that pathology, on that cancer.
Right, because everyone's different.
Everyone's different, and you've got all the experts in the room.
That's wonderful. You got that support. And let's talk about that, the support services that you offer for your patients.
So we consider that part of our multidisciplinary team. So in that support service arena, you've got rehab. So you may have speech and language, you may have wound care, those sorts of services. We have navigators that kind of help you get through the whole system. We have chaplains. We have social work that can help with after home care, connections to disability and things like that in the community. When someone gets cancer, it changes their entire life. And so it takes more than a doctor or a nurse to get them through it.
What about the wellness and survivorship overall?
Well, so one thing that science has done is it has helped people live a lot longer or indefinitely in a really great way. And having a survivorship program, which is a nationally recognized program, is how we stay in touch. We make sure they're doing their screenings. We make sure they're doing the right nutrition, the right exercise, whatever it is they feel they need to stay in a good place as they evolve down the road of cancer-free.
Right. It sounds very holistic.
It is,
you know, well-rounded and covering all the bases, and then you have that continued support for when, you know, because you're going to have to, like you said, keep doing the screenings and keep checking in and making sure that you're staying healthy and you're there along the way, which I think is fantastic.
And it's something that adds confidence to them on the, you know, you're 6 years out and you haven't seen cancer. Just getting that well checkup or just getting that your scans are clear is huge. And so
I want to piggyback off of that because that is so important. The scans, the screening, the prevention overall.
It is.
So touch on that a little bit.
Well, you know, you can't say it enough. What is great is because of all the screenings today, we are seeing people come in with stage 1, stage 2, and we're able to get the cancer early and get them treated. And sometimes they don't even have long-term treatments, but the sooner we can get it, the better. There's no reason to put it off. And that's what we tell people, you know, a year can matter. And so getting those mammograms, getting the lung screening, getting, you know, all of those things applicable to your age are very important.
Age and history.
Age and history.
Yeah. So thank you so much for what you do and what you offer here for our community. It is such important work and you're doing a fabulous job.
Thank you. It's a real privilege. Thank you so much.
Of course. And if you'd like to see this interview again, everyone, just head to First Coast News Plus.